When it comes to human anatomy, especially topics that are often considered private or sensitive, there's a remarkable amount of curiosity and, sometimes, confusion. The vagina, a central part of female anatomy, is one such topic that is surrounded by questions. How deep is it? What's the average size? And how much does it differ from one person to another? Let's explore these questions in a clear, respectful, and informative way. First, it's important to understand what the vagina actually is. The vagina is a muscular canal that extends from the external genitalia, known as the vulva, to the cervix, which is the opening to the uterus. It plays several vital roles in the body, including facilitating sexual intercourse, allowing menstrual blood to exit the body, and serving as the birth canal during childbirth. When people ask about the depth of the vagina, they're usually referring to the length of the vaginal canal from the vaginal opening to the cervix. The answer isn't as straightforward as a single number, because the vagina is not a rigid tube. It's a flexible, muscular structure capable of expanding and contracting. On average, the unaroused vagina is about 3 to 4 inches deep, which is roughly 8 to 10 centimeters. However, this measurement can vary significantly between individuals. Some vaginas may be a little shorter, while others may be a bit longer. But what truly sets the vagina apart is its remarkable ability to stretch and accommodate. During sexual arousal, the vagina can lengthen and widen, sometimes reaching up to 5 to 7 inches deep, or about 12 to 17 centimeters. This expansion is part of the body's natural response to arousal, making sexual activity more comfortable and accommodating. The depth of the vagina is not fixed. It can change in response to different situations, such as sexual arousal or childbirth. During childbirth, for example, the vagina is capable of stretching significantly to allow for the passage of a baby, showcasing its impressive elasticity. It's also important to consider that the cervix, which forms the upper end of the vaginal canal, can change position depending on a person's menstrual cycle or sexual arousal. During certain phases of the menstrual cycle, the cervix sits higher or lower within the vagina, which can subtly affect the perceived depth. Moving on to appearance, there is a broad range of what is considered normal when it comes to the vagina and the external genitalia, the vulva. The vulva includes the labia majora, the outer lips, the labia minora, the inner lips, the clitoris, the urethral opening, and the vaginal opening. Each person's anatomy is unique, and the size, shape, and color of the vulva and vagina can vary widely. Some people have larger or more prominent labia minora that extend beyond the labia majora, while others have labia minora that are smaller or tucked inside. The color of the skin in this area can range from pink to brown to darker hues, and all of these variations are within the spectrum of normal. The vaginal opening itself, when not spread open, is usually a small slit or oval. The appearance may also change with age, hormonal changes, and after childbirth. The vagina itself, being an internal structure, isn't visible from the outside. Its lining is composed of folds known as rugae, which allow it to stretch and accommodate objects, whether it's a tampon, a finger, a penis, or a baby during childbirth. These rugae give the vaginal walls a textured, ridged appearance inside, rather than being smooth. Another question that often arises is whether the size or shape of the vagina changes permanently over time. For the most part, the vagina is like a muscle. It can stretch and then contract back to its original shape. Events like childbirth can cause temporary changes, and some people may notice a lasting difference in tightness or elasticity. But for many, the vagina gradually returns to its pre-pregnancy state. Age and hormonal changes, such as those that occur during menopause, can also affect the elasticity and lubrication of the vagina. But these changes are a normal part of aging. The idea of a normal vagina is a myth perpetuated by media and cultural standards. In reality, there is incredible diversity in how vulvas and vaginas look, feel, and function. Medical professionals emphasize that unless there is pain, discomfort, or other symptoms, variations in size and appearance are not cause for concern. For those who are worried about odor, it's important to know that the vagina is self-cleaning. The natural secretions help maintain a healthy balance of bacteria and keep the environment acidic, which protects against infections. Scent can vary based on menstrual cycle, diet, hygiene, and other factors, but a strong, unpleasant odor, itching, or unusual discharge may indicate an infection and should be discussed with a healthcare provider. There are also many myths and misconceptions about the relationship between sexual activity and vaginal size. Some people believe that frequent sex or using tampons can permanently stretch the vagina, but this is not true. The vagina is designed to stretch and return to its usual shape. Only significant events, such as childbirth, might cause more lasting changes, and even then, the body's ability to recover is impressive. If you are concerned about the appearance, size, or function of your vagina or vulva, it's always a good idea to speak with a healthcare professional. They can provide reassurance and address any specific questions or concerns. In summary, the average unaroused vagina is about 3 to 4 inches deep, but this can expand up to 5 to 7 inches when aroused. The vagina and vulva come in a wide range of shapes, sizes, and colors, all of which are normal and healthy variations. The vagina is a flexible, dynamic organ that is designed to adapt to different situations, whether it's sexual activity, menstruation, or childbirth. Understanding the facts about anatomy can help dispel myths and promote a healthier, more confident perspective on one's body. Embracing the diversity of human bodies and recognizing that there is no single normal or ideal way to look or be is a powerful step towards self-acceptance and well-being. It's also important to foster open, honest conversations about sexual and reproductive health. Learning about one's own anatomy and that of others helps break down stigma and empowers people to make informed choices about their health and relationships. If you have questions or concerns about your body, don't hesitate to reach out to a trusted medical professional. They're there to help you understand and care for your body in the best way possible. Remember, every body is unique. What matters most is not how you compare to others, but how comfortable and confident you feel in your own skin. Whether talking about the average depth of the vagina, the appearance of the vulva, or any other aspect of anatomy, knowledge is the key to understanding and acceptance. By learning the facts, you can celebrate the incredible diversity and resilience of the human body.